Okay, my name is Yamilet Garza. I'm gonna go ahead and be performing hand hygiene by alcohol, hand sanitizer, and then soap and water, and then I'll be performing my administration of my PPE. So I'm gonna go ahead and begin by putting on alcohol. So this I would do it in situations where my hands are not visibly soiled, and from after leaving a patient's room and before performing any aseptic technique. So I'd go ahead and use a dispenser to administer the alcohol-based rub, and I'd go ahead and begin by covering all parts of my hands, making sure my fingers are covered, and we'd go ahead and do this for at least 15 seconds. Okay, in this situation, we do it for at least 15 seconds, like I said, or if there's, or unless it's already dry. So we'd go ahead. And after this, I will be performing hand hygiene by doing soap and water. So this we would go ahead and do it if the situation is that the patient, we have visibly soiled our hands before any eating or stepping out of the patient's room and going into a situation where I can contaminate anyone with the patient's previous patient's bodily fluids, or any blood on my hands, or anything concerning that sense. So I go ahead and begin by turning on the water to a warm temperature. So it is warm. I go ahead and begin by letting the water run down my hands from my wrist to my tip of my fingers. After I have done so, I go ahead and administer the soap. And I do this first. I go with the palm of my hands, and then the back of my hands, and then my knuckles. And each of my fingers. After about 20 seconds, we're gonna go ahead and clean under our fingernails. Since my hands are not visibly soiled, I go ahead and clean up to about my wrist area. But if my hands were visibly soiled, we go ahead and clean about 1 inch above the area that has been soiled. And then again, I go ahead and put my hands to allow them to the soap to fall down my fingers, making sure that I'm completely soap free. After I have done so, I go ahead and pat dry my hands. So I'd use my first paper towel to pat dry from my fingertips up to my hands to avoid like any breakage of my skin from any hard rubbing. So I make sure that that is completely dry. Okay, after I have done so, I go ahead and throw that first paper towel, and then I get my second paper towel and turn off the faucet, making sure not to contaminate my hands. So then again, I throw that paper towel, Now we'd go ahead and go perform PPE. So at this moment, we're gonna go ahead and perform PPE. We go ahead and do this if there's any need for contact precaution patients, isolation precaution patients, or any concern that requires us to perform, administer our PPE. So at this moment, I'd go ahead and first put my gown on and then my mask. If I were to have goggles, I'd go ahead and put my goggles on and then I'd put my gloves on. So I'm going to go ahead and do that. So I'd first begin by putting on the gown. Okay. I will now go ahead and put on my, tie it around my waist. At this moment, we'd go ahead and put on our masks to prevent getting contaminated. Making sure to pinch the nose area. I'm going to use my glasses as reference. I go ahead and put on my goggles now. And after I have done so, then I go ahead and put some clean gloves. Making sure when we put on our clean gloves that our gown is underneath. After we are done putting on all our PPE, then we can go ahead and enter the patient's room. Once we have gotten out of the patient's room, once we're done with the patient care that we've needed to done, we're going to go ahead and begin removing our PPE. So we begin with our gloves. So again, without touching the gown or anything, we're going to hook our gloves and wrap them into our hand, and then use our other hand and making sure not to touch any of the areas that are contaminated, and we dispose of them. After we have done so, we'd go ahead and remove our goggles and then remove our masks, and again dispose of them as necessary. Once we have done so, we are going to untie our gown. So since my gown is tied in the back, I wouldn't take it off until I'm ready to do so. So after I have taken off the knot in the back, I'd go ahead and remove my gown, making sure not to touch anything or any area that is unnecessarily contaminated, and making sure to wrap as necessary. After I have done so, I'd go ahead and dispose of it as properly. For verbalizing the prevention of contamination, we'd go ahead and do all these things to prevent cross-contamination to not only help the patient and prevent patient from getting unnecessary infections, or as well as for ourselves avoiding any contamination that could have been prevented by performing proper administration of protective equipment, as well as avoiding contaminating patients from one room to the next as a nurse travels visiting several of her patients throughout the day. So thank you very much.